Hello, everyone, and welcome to the Vector Podcast. My name is Christian Perez, and today we have a very special show. We are here with Dr. Sarah Mendoza from Austin Peay State University. Dr. Mendoza, why don't you introduce yourself?
So you said my name. I'm Dr. Sarah Mendoza, and we'll just go by Sarah for today.
Okay.
And I teach in the Department of Psychological Science and Counseling, and I am starting to work with AI in the classroom, which is why I'm here, basically.
Awesome.
We connected for a panel.
Yeah.
One of the cultivators of the panel is one of my students. And when she invited me, I was like, yeah,
Okay.
I'm in.
Yeah.
I'm in. Like, sure. Yeah. I tend to say yes. I'm new, but I want to get out there and see
Sure.
what they're doing. And I was impressed with how full it was.
No,
So.
absolutely. So before you got here,
Mhm.
let's talk a little bit about the history of Sarah.
Sarah.
Yeah.
So I went straight through. I did my bachelor's and my master's. And I think I realized somewhere in my bachelor's degree in psychology, I can't talk to humans alone. If I want to be a counselor, I need to keep going to school. And I did. So I went straight through, and then I worked for 10 years. And that's not a typical trajectory in terms of getting into higher education and being a provider. Most people work 3, maybe 5 years. And I think what happened in that time is I worked in predominantly what we call higher levels of care. So hospitals, Joint Commission accredited hospital for 8 years was my longest stay. It was a residential hospital, and intensive outpatient treatment with sober living. And in these environments, you see people again and again who have gotten treatment that did not result in relief, remission, those kinds of clinical terms. And I got to work on integrative teams. So I got the benefit of working with nurses, social workers, psychiatrists, regular doctors. So primary care, sending someone to the dentist. If you've been ill, maybe you've neglected parts of your well-being and health. And I was like, I think I'm ready to train counselors.
Yeah.
I'm ready to go back to school and start to train people for the integrative care model to prepare for what's really out there. Because I would just hear kind of wild stories from people I was admitting. And I would just be like, what is going on?
Yeah.
So that took me back to school in 2019. I had no idea the pandemic was coming. I was
That's right, yeah.
interestingly protected
Yeah.
because I was not a care provider during what must have been a very difficult time. I was a student, and I got to be at home and go to school. It changed my school experience to some extent. Conferences, things like that didn't happen, but I had a really good experience overall at the University of Central Florida. That's my training institution. And then I spent some time at Montana State University before coming to Austin Peay State University. And really just happy to be here. It's a forward-thinking school.
That's fantastic. What was it that really sparked that genuine interest in teaching?
They used to call me a jack of all trades, or we all get it in our team that I worked on, reputations.
Sure.
Let's just say that this person's strength is this or that. And they would kind of tease me about knowing all this random stuff. And I'm like, you guys, I could just read.
Yeah.
I read. And I think that there was somewhere in there where I realized I would walk into a room and it really didn't matter. I was comfortable. Somewhere in my 6th year, I was like, oh, whatever it is, I'll figure it out. And I'll be able to consult with the right person about what I don't know.
Yeah.
That's another piece, right? I'm not a nurse. I'm not a psychiatrist.
Right.
So if I have this conversation with someone, I'll be able to kind of use the team. And so I think it really came from encouragement from my peers,
Sure.
from getting kind of a reputation of check in, what's that about? And things that affect the quality of human life.
Yeah.
I think that's the thing is so why do I know this piece of information? Well, it was affecting one of my clients, right? Or patients, really. So I'm going to use an interesting example. I had a client or patient who came in and she's like, tell the doctor I'm not going to take, and she named a medication because it makes my hair fall out.
Okay.
So, we're talking about it kind of in our area, our pod area as a team. And I end up learning from the doctor that medication doesn't make your hair fall out. It makes it break.
Oh.
So because she was brushing her hair, it broke.
I see.
And I'm like, well, that's something that's not that is way down the list on the
Right.
possible side effects. So I think that was other piece too, is you learn in a 2-directional way when you've been working for 10 years with clients. They're the expert on their own life, on their own body. And that's a real big part of counseling is that autonomy and respect for the person you're working with to make decisions about their care.
It sounds to me like that aspect of learning, despite the fact that now you're teaching, it never stops. It's not a matter of knowing exactly the right answer at the right time all the time, but at the very least being able to go find that answer and be deliberate in that attempt, in that effort.
I think I said this all the time, and get ahead of it when you know you made a mistake,
Right.
or even speculate that you made a mistake. And I'm really fortunate that I worked on very patient, forgiving teams who allowed us to all make mistakes and teach each other and also hold each other accountable.
Yeah.
Because there's an accountability piece whenever you're interacting with the quality of human life and illness, and
Oh, for sure.
even in teaching, right? The information I disseminate needs to meet accreditation standards and, help my students go off into the world prepared at a foundational knowledge level that makes them appropriate to enter the field under supervision.
Of course.
Yeah.
I mean, that's a lot of weight. Because I mean, you're priming the next generation of individuals that are gonna go out there and treat real human beings. And these are real lives that are in dire need. And the expectation is that they're gonna come out of these institutions, out of these, educational facilities, and learning from people like you who have had ample experience, taking that knowledge, taking that wisdom, taking that, and then going out there and practicing it on their own.
You do have to be supervised for at least 2 years. So there's like this,
Fair enough.
there's this
You're right.
space after school
Yeah.
where we protect the public and
Sure.
someone is watching that student. So there's like tiers of
Do
the
you remember
learning.
those days for you? Like,
Yes.
like
Oh my
what was
gosh,
that
yes.
like? What was the first day that you walked into, let's say, a clinical setting?
Yeah.
Like, what was that like?
Nerve-wracking. Like I was
Yeah.
very nervous. I think also being younger when I started, like
Yeah.
having gone straight through being in
Yeah.
my mid-20s, I was like, nobody cares what I think. I'm
Mm.
not even 30. So yeah, I was pretty nerve-wracked. And you do start seeing clients when you're in school.
Right. Okay.
And I think one of the pivotal pieces of my training where when I look back, I'm like, gosh, I was on a team where it was a locked inpatient unit and they would go through detox and most of them had more than one diagnosis, but the primary need for treatment that they would come in for is substance use.
Okay.
And that year, 8 patients died. And I was totally unprepared for that. Like I just didn't think about the heroin epidemic was kind of blowing up. It was like 2008, 2009. Like there was this whole culture of like shifting realities in the drug world. And I was like, I better get good at this. I don't have long enough with people to not be good at this. And so I really dug into like motivational interviewing and solution-focused therapies that are meant for inpatient stays. And I had a great supervisor and great doctors working around me and nurses. And so I also learned how to like lean on the team because I was the student. I was supposed to be there to learn.
All right. So then, you get your first sort of like exposure to the real clinical setting. You start seeing real patients. You start actually dealing with that very challenging aspect of life and death. What is that like? What was that like for you to process that? So early on, to suddenly come to the realization that like the actions that you take can actively affect the life expectancy of another individual.
I would ask that. So I'm going to repeat what someone told me.
Sure.
And so I was working with Dr. Enrique Lopez, and I said, like, how do you live with this? Because I think the buck stops a lot with the doctor, like the medical management piece. They're like the ranking member of the team.
Yeah.
And he said, when I'm with people, I treat them with dignity and respect, and I collaborate with them on their care. And I know for the time that they're with me, I've extended their life and I've given them the options to extend their life in various ways by choosing aftercare, by choosing medication management, and engaging with their own treatment process as an expert on what's going to work for them and what they're willing or not willing to do.
Yeah.
And another phrase that came about later in my career was from a social worker, and is you can't or you won't, and there's a difference. So we don't want to blame the victim when someone really can't like pull themselves up by the bootstraps or just move through a process versus willfully won't. You won't try this or you can't do this. And I think those empowering pieces around choice really move into a spiritual place for me. Like I'm in someone's life for like this fraction, even if I work with them for like a couple years, like it's still in their lifespan a very small period of time. Like I have to see them as a human being with all these multiple dimensions that they live in, and I'm treating them with all the things that Dr. Lopez outlined, like dignity and respect and autonomy and choice and free will and all the pieces that exist beyond the space of the helper. And then make sure that they know, is this that you can't do this or that you won't try it because of some other fear? Can we process that? Can we explore the wall that you feel like you run into? Is this something else happening? And then providing education. There's a lot of education in the early stages of recovery, especially of like, yeah, your brain's going to tell you to go do the same things over and over again, and like normalizing that, validating their experiences, giving them support.
So now, we discussed some of the, more heartbreaking or difficult stories behind it. Have you seen success stories from individuals who've just absolutely thrived despite having, been in those circumstances? Could you share a little bit about that?
So I think that that's the piece where like it hooks you. So you see someone, they come into a detoxification program, they have their own mental health, their substance use, and like they're a different human. They've been through detox, they've been through 14 days of treatment, they come back to an alumni meeting, they're living in sober housing, and you're like, wow, they come in gray, ashen, underweight sometimes, or overweight, bloated, symptomatic. And all of a sudden you're like, this is you. Oh, like here's a person who under all those layers of suffering was waiting to emerge again. I had one, I remember really distinctly, I was not very familiar with methadone, but she had been aligned with that. Didn't know she was pregnant when she came in. We didn't know she was pregnant. She was that early in her pregnancy. I saw her later and she's like, I didn't know when I came in. And her whole life changed. Like she went on methadone for the pregnancy. She went into sober housing. She just shifted. Like it was like pivot. Like, And it was beautiful to see her become a mother and to take proper steps and to never have to have a big episode of like losing her baby or having the Department of Children and Families involved. Like you do see success. It can be heartbreaking. Obviously, I come from the mentality of like a biological, we call it biopsychosocial, so biological, psychological, social model.
Okay.
And all of us are subject to being in a body.
Right.
But there's so many shifts and changes you can see even in short periods of time that you're like, wow, humans are so resilient.
Huh.
So resilient.
That's amazing.
Yeah.
That's amazing. Fast forward a few years, in comes artificial intelligence.
Yeah.
Right? Now we're dealing with a computer who's a human attempt at grasping human cognition and the ability to think and formulate thought and ideas. Now, this has been a paradigm shift. This has absolutely fundamentally changed the way that almost every sector operates. But how has that shaped your approach to interacting with humans? Like, is it a tool you use? Are you vehemently opposed to it? Like, how do you marry the two? When you're so committed to understanding the depth of an individual and simultaneously working alongside a machine.
Yeah. I think that's the commitment. I've come to a place, and I want to say like it's been an evolving truth. I was talking about this with my husband, Jay. I was pretty afraid. I think, if you had talked to me a year ago, even maybe a year and a half ago, I'd have been like, I don't want to be replaced by AI. Like I'm a counselor and I'm an educator. And like, what is, and there's this maybe in the background of my mind, the story of automation and how automation took jobs from line workers. Right. So I'm like, oh, I don't want to be replaced. And so now I'm like, oh, this isn't smarter than me. This is a tool I can use to support and to also support students and clients. And I'm less afraid, but you got to get your hands in or it becomes this like distant sort of elusive thing. So I want to give credit to Jay because he really helped me kind of come along and figure out. And the first thing that we used it for to just sort of explore was a psychopharmacology class I was teaching. So psychopharmacology is important. Like how does medication work? What do you need to know, not know? And the output was really good for depression and anxiety. And this was just a full web. Like I didn't control any of the information. I just was like, okay, what would it say if I were to give a lecture on this? Abysmal about eating disorders. I was like, oh, I couldn't use any of this. Like this is not a win.
Yeah.
And so I think that's how I want students and clients and people who are using these tools to start to have relationships with the technology that is augmentative and supportive without replacing the human critical thinking factor or their expertise or just trusting that like an agent can do some things and humans are much more able to do things on a whole if we properly use AI tools, right?
No,
Like
absolutely.
we can augment, but we can't really replace.
What do you think humans provide that machines can't?
Well, my first thought is like an empathic relationship, right?
Okay.
So there's like one of the key factors in any counseling dynamic is like, do you trust your counselor? Would you tell them something? And I think depending on your personal background, a machine might feel safer. There's a lot of trauma in this world. There's a lot of people who have not had safe environments, to be honest and open. So I'd rather someone start with a chat or something. And then now, because of what's happened, they have places where the chat seems to shut down and say, you need to talk to a human. Or the things you're saying, you need to go see a counselor. And we saw this with like Claude and like some of them, they've really put in some measures for safety because of things that have happened. And I'm hopeful about that because there is a pivot, right, where we shouldn't be just machine talking. But if that's where you have to start, there's already many apps that include cognitive behavioral therapy techniques, behavioral activation techniques that are just helping people to kind of like sort.
Yeah.
So is that machine able to be a sentient being with you? No. Is it reading your body language? A lot of communication is body language. More communication is body language than words. And a large language model is just predicting the next word. It's not really reading the whole picture. So I think that that's another piece where I really see the human element being needed. I also want humans to heal with humans. That's a bias. So that's a personal like counselor position, right? Like there's a phrase, Jail Moreno would say, we're wounded by the crowd and we're healed by the crowd. So we have to have human relationships to heal past pain with humans. AI is not going to fix that.
Why do you think it's easier for people to start with a machine?
Because the machine hasn't wounded them. It's kind of like, why is it easier to eat a Snickers than like blueberries? A blueberry box is inconsistent. Some are going to be sour, some are going to be sweeter. So, it's like a natural product, right?
Okay.
But if I bite into a Snickers, it's consistent. And so their relationship with the machine model may be more consistent than their relationship with humans. And that's where sometimes I'm like, oh, I'd rather start there than nowhere.
Right.
Like, I mean, I'm as a professional worried about things like loneliness and isolation. And we have all these statistics around the 2013 mark of like increased anxiety and depression as phones and apps like went up and internalizing things. Like if it's a starting point that helps you get to the care you need, that's better than nothing. It's kind of like where people came along with telehealth. Oh, I want to meet people in my office. I want to see them. I need to see them. If someone is suffering with agoraphobia, that's the term for like when people can't leave their home and they do telehealth, like better than not getting any care. And we kind of have to meet people where they are.
You mentioned before the podcast that you're using AI in some aspects of your curriculum.
Yep.
Do you want to talk a little bit about that and how
Yeah.
that's kind of played into your classes and how that's affected your students? And that
I
be
love
great.
my students. I really do. They're the best. They're so fun. And they're so intent on helping their clients. So in the classroom, I'm currently using it in one of my more didactic classroom
Sure.
settings. So I lecture the class is addictions and counseling. And I have a few things. So I've used Notebook LM and I've created a notebook. And so by that process, I'm not violating my relationship with the publisher of the textbook. I have
Right.
a controlled kind of not shared with the internet. I've uploaded the tools that I've been given as an instructor, and I've created podcasts and videos.
Mhm.
And so they can engage with our weekly lecture series. And sometimes it's one chapter, sometimes it's more than one chapter, where I can use that and create other ways for them to connect to the material. And it feels like a mouche bouche, like if you were a chef, right?
Mhm.
Like here's a
Mhm.
little sample.
Yeah.
It doesn't replace the textbook. It's not giving the case examples in the textbook. And if it gets them to connect with the material and maybe go open that chapter or think, that was in the talk. Like, just we have to, as human beings, cognitively hear something more than once to retain it. And we have to
Yes.
rehearse
Yes.
within 24 hours.
Yeah.
So if I'm giving you more than one way to get into this material and it's helping you to engage with your textbook, with the audio process, with the visual process, and then we're in class doing experiential learning,
Hmm.
I'm really trying to hit universal design as an instructor and give them lots of ways to connect with the content I'm providing.
That-
And then I teach them what I do. I
Yeah.
say, this is how I use this. This is how I create it. And this is how I know you're not getting junk. Because I want
Yeah.
them to know how to use AI to
Right.
control the output.
One of the big issues with artificial intelligence is what we call hallucinations,
Yeah.
where the model in and of itself infers what it thinks is correct, or it explicitly says something as if it were correct, but it's not.
Mm-mm.
And I think in many ways this is where human expertise comes into play, and where it's imperative that people don't just blindly rely on whatever AI output comes in and act accordingly, but rather verify. It's
Mhm.
one of the, in the military we have a saying called trust but verify. And I think it definitely applies even in this aspect of things. Sure, I trust that AI is actively making a genuine effort
Sure.
to provide me with the knowledge that it has been trained on. But especially when it's actionable, I think it's imperative that you verify and fact check and ensure that the sources that it's citing say explicitly some of the things that it's telling you. So in your case, what are some of the things that you've sort of included in your practice to ensure that that's the case?
Well, I think the notebook LM controlling the sources,
Mhm.
right? If I create a notebook or create a site there, and then with enterprise, use like
Yeah.
the Microsoft. Okay, so I have created like we have all these handbooks and we have ethical codes and we have the groups that we belong to, the American Counseling Association. All this, I've made those searchable
Mm.
for them. So like I need you to know that I've controlled where this
Mhm.
pulls information from. I don't want you to ask an ethical dilemma question to the internet.
Yeah.
I want you to ask it to the governing body of our discipline
Oh, wow. Yeah.
and to have that come up. And so I show them that. And then, so I think one thing, the takeaway there is the resource of information. I don't open it up to the whole web. And if I do, I need to be more about the verification of
Mhm.
that.
Mhm.
And so when you use tools like Perplexity, if it will link the source or
Mhm.
ChatGPT links the source,
Mhm.
like you need to understand like what's a contributor that you want and a contributor that you don't want. And then
Hmm.
some of the search engines do allow you to say like, I just want to use the academic sources. I
Yes.
don't want to use the whole World Wide Web. And those are things where I feel like we can't pretend that AI is going away. We need to make our students aware that we're aware, like learn with them, even
Mhm.
if I'm not, I learn with my students all the time. Like, this is what I'm understanding. This is how it looks
Yeah.
when I'm using it. This is the tools that I'm using. So, because I want you to have a searchable way to ask that question, like, how many hours do I need to graduate? How many of those hours are direct client contact? How many of those can be non-specific? So they read these handbooks, but then, okay, when I'm in a moment where I just need to pull up one piece of the information versus like asking the web, that may or may not get
Hmm.
to the right answer for this program at this university for this accreditation.
All right, so you touched on some really interesting points, and I think one of the things that is incredibly important in this case is the fact that AI, like you mentioned, is a tool.
Mhm.
Right? AI is a fantastic tool that you can leverage, that you can use, as long as you do so, like any tool, you do so intelligently. Now,
Ethically.
and ethically,
I
you're
think
right.
that's the piece,
Okay,
like,
that's
there's like
great.
an ethical piece to it, right?
Go ahead. Yeah, please elaborate.
Okay, so like what I'm doing with the Notebook LM with the instructor materials,
Mhm.
not violating my relationship with the publisher.
Sure.
So I'm not putting them all online.
Right.
If I have, for instance, a BAA with
Okay.
Perplexity,
Mhm.
then I'm not violating FERPA or HIPAA.
Mhm.
And if anything were breached, they could sue Perplexity. If I were to pretend, like, per se, take a discussion post series, I
Mhm.
would de-identify it all if I was going to
Mhm.
use it in a non-BAA situation. Like, I need to not have my students' names attached to their work. If I want to do a
Mhm.
thematic analysis of their discussion posts, better de-identify all of
Right.
that. Because there's these ethical pieces of like, you don't need all your stuff on there.
Right.
Even as a student, like, it's just, there's a lot of privacy and protections there. And I never want to write a textbook, but if somebody put my whole textbook on the web, that would be maybe annoying because I worked really hard to create that.
Of course. No, it's I think that's a massive issue that's going on right now with copyright infringement and trying to understand how these language models are actually learning what they're learning. There, I think that's a very important point. And I think that there's a lot moving in that direction with AI, trying to silo data for that purpose, for protecting privacy and protecting individuals' works. But I don't think we're fully there yet.
No, and I think I'm still learning. Like I don't, I know that I'm doing something ethical with Notebook LM right now
Yeah.
because APSU had an AI day, a symposium, and we have another one coming up. And they're a very forward-thinking university. So Google came, they demonstrated, and even though I kind of clunked along the demonstration, I got to the other side and realized how I could do that. And we can embed tools in our D2L or distance to learning, desire to learn program. Sorry, just make those searchable tools to Microsoft and link them. And so I'm in a growth curve myself and like have future goals for like what do I want to make searchable for the students? What do I want them to be focused on reading, or how does this look for them? But I think the consumers change too. You have to remember that like these students grew up with smartphones. Right. Their whole developmental process and relationship with technology is going to be different than mine. It's still really different. So their consumption of material and how they expect to get it and like is also different. So it's not going anywhere. So how can I learn with them, use it, be ethical? One thing that came to mind as you were talking about ethics is we train students to write in a certain note style. And that might change depending on where they work. But I had a student who was like saying, I'm doing an info dump. And then I'm having the chatbot help me sort, like, what area of the note would this go in? Because a SOAP note is like subjective, objective assessment plan. And like, I'm learning to put process with my client over content. I'm not putting their content. I'm putting the process they're in, and the therapy is really more important because that relationship to how you handle anger, that relationship to how you communicate is more, you're never going to stop communicating. You're never going to quit getting mad or sad or having core emotions. Right. And so like, we talked about that and how is that ethical or not ethical, and how is she de-identifying things, and does her supervisor know? And like, these are things that like you can literally have your session listened to and the note written for you. Right. So I can't pretend that's not going to be immediately what my students are walking into. Was that available? No, I wrote in a paper chart and then my supervisor had to read it and sign it. And we had like these 3-ring binders and all these things, but it's there, like it's real, it's happening. Absolutely. So where is the value added, or is there value lost in that sense of efficiency? I'll call it efficiency if and only if it actually is a benefit to both the patient and the provider, right? If that's the case, then I would argue it's efficient. But is there con to that being the case? Would you rather, I guess, see a patient, have that interaction with them while an AI system is taking notes for you, or would you rather do the note taking yourself because you feel like there's value in there? I'm going to be old school. I like notes. I got good at writing notes in acute care under a lot of supervision with really good support. And I still give them all those tools. Like I have a laminated sheet I give them. I'm like, these are good verbs for mental health notes. And I give them like a grid and all this stuff. No. But I don't want to pretend that's every counselor. And I wouldn't be uncomfortable with my notes being kind of run through some sort of system. Like, okay, here's what the counselor generated, clean it up, or like fit this into the system. And so with students, that trust verify piece, like, okay, so how would you write it if? And how does this output? What do you like about this? What do you not like about this? Because a SOAP note is like a whole AI tool. You can use that, right? So still trust and verify. Did it leave out a piece that you would want the next counselor to know? Right. Like is there anything missing that's vital? Or did there was there a lack of a safety assessment? Like what is in there that you not need? How would this help you to grow your own clinical knowledge or own wording? Like, I think it can be that tool, right? And I think in the developmental stages early on where I'm with them, I want them to think of it as a tool and as a piece of their development. So it may take them more time in the beginning. Yeah. It took me more time in the beginning, like looking at all the output and being like, oh, yes, no, maybe some of this, maybe some of that. And then we'll get more efficient. And you can decide, hey, if I were called into court for my clinical treatment notes, would this be acceptable to me? Because that's where the liability lies, right? So like if you hold a professional license, if you're providing care, you can't sit in front of a judge about a case and say like, well, I use this tool and it wrote the note. That's your note. That's your signature. That's your license. Right. So that piece, right? Of 100%. Like, you need to be able to stand on your own 2 feet. Not knowing is not an answer. Right. So have you seen personally AI applied in the clinical setting? I have seen it with my husband's neurologist. She turns her phone around like on the table and just says, this will record. And then when we got some notes, we sent back corrections. Even things like the year of an incident was incorrect. Yeah. So I have not personally used it. I am going to the AI symposium on Halloween, and there is one talk I'll attend just on the therapeutic uses that we're finding with AI. And the speaker is a social worker, a professional social worker, and an educator here in our social work department. So I look forward to that. Like, what do I not know? So like I'm aware of these programs, but again, like I came up in paper charts
Mhm.
and EMRs, but electronic medical records weren't doing our notes for us. That kind of just shows how far we've come in a short period of time
Yes.
to me, right?
Definitely.
Like I left the direct care workforce in 2019. I have been back in that workforce in an outpatient setting.
Mhm.
So like I use simple practice. I still wrote like, we still write everything.
Sure.
And it'll include things like date and time and, there are pieces it'll carry from note to note, but it's not writing the note for me. That's an
Gotcha.
add to that you pay for. So yeah, I'm thinking to myself, like that just shows how far we've come in a short period of
Yeah.
time that you can have an AI tool listen to your session and create your notes.
And I think the technology is absolutely like breathtaking, in many ways. And one of the things that struck me was when ChatGPT released their newest model. One of the families that they had on in their debut was a couple, and the wife disclosed that she actually used ChatGPT to understand her cancer diagnosis and to go through that,
Mm.
through that journey, to start that journey alongside ChatGPT. And so one of the things that it kind of brought to mind is the fact that we could potentially start seeing soon is far more educated patients, simply because they have the ability to query a lot of their diagnoses, a lot of the terminology that they may perhaps not necessarily know. How do you see that interaction coming into play when now you're having a patient come in and saying, "Well, ChatGPT said X, Y, Z."
I'd be curious. I would say, tell me more about what your dialogue was with ChatGPT and
Mhm.
how did this land with you and what do you see as valuable in this? And one, if I'm not a specialist in that area, so let's say they come in and ask for a very specific intervention, like I would like to do EMDR, eye movement rapid desensitization, and that's, God say that 10 times fast. And I'm not certified in that. So I would say, like, I'll need to refer you if this is the route you want to take. But also, if it's something else, like, I want to be open to that.
Mm,
Um, and you're like kind of speaking an experience I've been through as a wife.
mm,
So with my spouse, with my husband, Jay has been through quite the medical journey. And sometimes we have provided literature to his providers.
mhm,
So here are these peer reviewed journal articles out of medical journals that speak to the experience he's living. He also has some genetic patients. We have some genetic SNPs that change like the way he metabolizes medication. So
sure.
like he's a fast metabolizer, and that's something you can study. That's very much in the science.
Mm,
Like what lasts for you 6 hours might last for somebody else 4. Talking about that, and like the relationship that I want to sympathize with, like for in terms of medical, especially, is like the pace.
mhm,
And I mean, you have served in that capacity, right? Like
mm,
it's unrelenting. The publication process, I think it's like 2 million articles are produced a year. And so even though we have tools like up to date and we can go
mhm,
look for, I think it's really important to be an informed consumer when it comes to your medical well-being and your health. Like it's okay to know more about your specific body,
mhm.
your genetic SNPs, the way you respond to medicine, experiences you're having that align with the science,
Yeah.
and share that science with them in a non-confrontational like discussion way. Because if you're only gonna get 15 to 20 minutes with your provider, like, yeah, you need to go in knowing something about what you're asking for. I also feel like ChatGPT might upend some of the pharmaceutical stuff because
Mm,
a lot of the times managed care wants you to fail cheaper generic medications before you get the most recent patented
right.
thing. So I wonder how that will look because
Yeah.
if we look at the most recent data, we're going to see better outcomes with newer meds.
Right.
But they're like, oh, well, there's this other thing. We want you to fail these, this class of medication
Sure.
first because it's like $15 or something. And we've been through that journey, like as a couple, like as a married couple, like we've had to fail 3 medications to get to the newest thing covered by
Mm,
insurance. But I think if you looked at the current data, the medication that finally got approved is much more sophisticated and binds to the proper receptor sites in the brain. And that's what we're looking for, right? We're looking for efficiency. So I think we're in a rich
yeah.
time for that too.
So, I mean, and that's what's so wild, right? Like we kind of started this conversation talking about how artificial intelligence has fundamentally shifted every single aspect of our day-to-day life, even, like you've discussed, from education to clinical practice, pharmaceuticals. I mean, we can now use artificial intelligence to enhance CRISPR and gene therapy
Yep.
and, future medications. And how do we keep up?
I think that's like conversations like this and relationships with peers and
Mhm,
community and colleagues and like, have you heard this thing? Or like for me, perplexity and my growing relationship with perplexity looks
mm,
different than Notebook LM. And I sat next to someone who works in accounting who's been using Notebook LM for years in that demonstration and the AI
mhm,
symposium. And I'm like, oh wow. So like I think what I'm learning is the culture of where you are as an educator and as a provider is vital.
mm,
So coming to APSU, the culture is so open. AI is not going anywhere. Let's make it ethical use. Let's show our students how to demonstrate critical thinking
mm,
with AI,
mm,
right? So I was using it just yesterday with research.
mhm.
But like if I don't know how to use the research methodology that's suggested, I can't, right? And that's where like you need to know something. You can't just take what it spits out and create a research study.
Yeah.
Like you have to be able to implement. So I think that those are things I really appreciate about being here is like, how do we keep up? Well, you won't potentially. You won't ever know everything, but you'll start to see best practices in colleagues if we share mistakes. You talked about that in your opening podcast, and I loved that. You're like, listen, if we make a mistake, we'll come back and correct it. And I'm like, yeah, I don't always agree with myself in like 3 months. Like, I don't know, I might look back at this and be like, no, I changed my mind on that. Or the technology's evolved, or, now I'm realizing this other thing. So I think that's the piece. It's like we have to be a community of learners and be in a culture that accepts that we may not know, and we have to ask good questions. And if we have peers we can come to and things we can look at, like that's key.
What do you think is the future of AI at its max? There's ever going to be a world where it far exceeds human cognition, understanding, and knowledge? Do you think that there will be sort of a time where once you introduce robotics, right? Because that's sort of the next phase of this, right? So we currently have artificial intelligence that is sort of boxed into our desktop or laptop or phone, whatever it may be. Now we go ahead and take that artificial intelligence and embed it into a system that can walk in 3 dimensions, right? That can move, that can operate, that can actually act within our ecosystem, not just our laptops and our desktops, but rather our actual space. What do you foresee the future of AI looking like once we include robotics?
I have both in my brain. Like I have a dystopian view
Okay.
where I'm like, people don't get too into the robot. Like that's not a person. And then I also have like some sense that like we could get there without so much harm as the dystopian view portrays, right? I think for me, like the incremental steps I've made in the last year tell me I don't even know where we'll be a year from now, if that makes sense. Like I started out afraid of being replaced. Like, I don't know, like and now I'm like, I got to use it in my classroom. I want to show my students how to use it ethically. I want to talk to them about the way it shows up in clinical practice. And like, again, I go back to this piece of like, could a robot do intake paperwork? Like what would my brain expand to be open to if it's just the instructions, right? Like if it's just like demographics, like where's the ethical line there in terms of robotics and AI? But it like takes me to the Jetsons, right? And the Jetsons are available on Hulu right now.
That's fantastic.
So if you want to play those for your kids. But there's a piece of like, I don't want it to just be like pushing buttons, but there's also something about automation, AI, then robotics AI that feels like a progression that's inevitable.
What would you say to an up-and-coming professional, someone who's growing in the field that you're an expert in, right? This is your subject matter expertise, opening their eyes to the world of AI, but simultaneously opening their eyes to the reality of that human condition that they're having to deal with and address. What is the number one piece of advice that you would give them when it comes to marrying the two together, how to leverage technology, how to move forward in this field, given the ever-evolving environment?
Look at everything through an ethical lens first. Is this ethical in terms of like beneficence, justice, first do no harm, and privacy, HIPAA, FERPA if you're an educator, right? If you can know that you are safeguarded in those very critical ways, then is it ethical in terms of your own presence? Like when you sign that note, like will you recall this session if you're using an automation tool, not as well as if you wrote it? Because there's a piece of that is tied to memory, right? The action itself of making word selection or typing and writing. So that would be my thing. And get into it. Like, don't be afraid to try something and test it out and see if you like it, see if you don't like it, learn about how those boundaries and guardrails are applied and talk to your colleagues. It's here to stay. So you need to have a relationship with all the tools that are coming out, and you may or may not use them all, may or may not find them all useful, but you need to have baseline knowledge, even in fields where you think of yourself as irreplaceable because of the human factor. That doesn't mean we won't have AI. That doesn't mean it won't be part of the dynamics in our workplace. And I just think about hospitals and like big systems, like this is here to stay. I don't know what it'll look like entirely, but get used to like being in the process of learning and growing with those tools and looking at them through an ethical lens.
That's fantastic. Yeah. Well, Dr. Sarah Mendoza, thank you so much for your time. I really appreciate it. Thank you so much. This has been the Vector Podcast. Dr. Sarah Mendoza, where can people find you?
I am on LinkedIn, so they can find me there. And I've said where I work, so you can find me here at APSU.
This has been another episode of the Vector Podcast. Now would be a fantastic time for you to click like, subscribe to the channel, and I will catch you all in the next one.